How do you select an animal with the intention of them becoming a therapy or facility animal? It's a topic I consult on a lot, and I think it's where a lot of people get stuck. There's many people who have the desire to share the love of animals in their community, whether that's as a volunteer, going into places like nursing homes and hospitals with a pet who's a therapy animal, or if you're a professional who's looking to integrate an animal into your formal treatment plan or educational offerings. But where do you find the right animal? I think often we're limited because we're a bit too narrow in how we conceptualize what a therapy animal looks like. Here in just a moment, I'm going to talk about some core characteristics that we look for. I'm also going to show you in this video many of my pets who are both therapy animals and ones who are not therapy animals and why. We'll talk a little bit about temperament test, but it's important to keep in mind when we think about therapy and facility animals, we are not looking for robotic animals who are perfectly trained. They, of course, are going to need to have a trained relationship with their handler, follow cues, be appropriate in public. But more importantly, we're looking for animals that are highly affiliative, meaning they seek interactions with people outside of known humans. You can often see the traits of an affiliative animal very early, whether it's a puppy or a rescue dog who you're working with, an adult dog. You're also looking for a dog that has a certain level of confidence or recovery. We always try to keep as much stress out of a therapy animal environment as possible, but when we take an animal into a very human world, they're going to interact with stimuli that will cause low levels of stress and require quick recovery so that overall the job is more rewarding than more taxing. I want to hear from you as we go into today's topic. Do you have a therapy or facility animal that you work with? If so, comment their breed, their species, how you came to get them. If you don't and you found barriers, put them in the comments and I'll address those in future videos.
My name is Dr. Taylor Chastain Griffin, and I've dedicated my life to studying the human-animal bond. With a background as a dog trainer, mental health counselor, researcher, and therapy animal expert, my mission is to show others what happens when we become the people our dogs think we are.
When we think about choosing a therapy animal, there are many different paths and there's a lot of complexities to consider. So Haven is one of my adult therapy animals and she came to me as an adult. She was a rescue dog. I work with rescues. I've done it for many years and I'm a big fan of rescue dogs in the therapy animal space. For me, being able to find Haven depend a lot on finding a local rescue group who I knew and trusted. They had a good understanding of the work that I could do and the kind of dog that I needed. So Haven came to me with all of the right traits. She, as you can probably tell, really loves affection. She's very snuggly. She was in a foster home and even her previous home with young kids and thrived there. She has a very gentle, calm demeanor. Now, one thing we had to work on with Haven, though, when she came to me, we really had to build her confidence. I don't think she'd had much stability in her life. I'm not exactly sure what all she had gone through, but it took a long time, about a year of us working together for her to really trust me and come out of her shell. But she is such a great mix for me. We think not only just about the temperament of the therapy animal, so they need to be affiliative, meaning they seek interactions with new people. They need to be a dog who likes to meet new people, but also the chemistry. Me and Haven have a very special chemistry together and working together. She has a stabilizing, calm energy, a very knowing, intuitive presence, and just makes a wonderful therapy animal. So I look for dogs with her traits when I think about partners for me in this work. This is Adler, another one of my therapy dogs in training, and like Haven, Adler is a rescue. He came from a wonderful local rescue group, and I had been talking with them for a while in different rescue groups saying, I'm looking for a really small dog who travels well but doesn't meet a stranger, a dog who really is highly affiliative and joyful, and Adler is just that. He is very affectionate. He always wants to be in someone's lap, and he's not one of those small dogs who necessarily has to be in my lap. He would be happy to be with almost anyone as long as they're being sweet and kind to him. Now, he is not the kind of therapy dog who's going to be inclined to learn a lot of different tricks and do a lot of different performance cues. He just wants to be in the presence of people, but he is very joyful, very affectionate. He has trust me, so if we go into complex settings, he'll look to me for reassurance, and that's something we look for in all of our therapy dog partners. So let's talk about another one of my beloved dogs who's an incredible pet. Her name is Josie. I got her with the intention of being a therapy dog, and she's almost there, 99.9% of the way there. Affectionate, confident. The rescue group did a great job identifying those parts of her personality. But as Josie started to settle into the home, we learned a little quirk of her behavior. Now, she came to us as an adult, as a rescue, so likely had a rough past. Now, Josie has a very low bite inhibition, but also very rare, hard to see. It's no surprise that that never showed up at the rescue group. But when she got home with us and got settled in, we learned that if you move her bed unexpectedly or take something that she has in her mouth, she will not only warn you, she will go right for a bite. So we've learned to work around that. We keep her safe, us safe, but of course this is an issue that prohibits her from being a therapy dog, so she is still a beloved pet. Anytime you take an animal into your home with the goal of having them become a therapy or facility animal, we have to be ready for that potential. We only want animals who will really thrive in this role, and if they show a red flag, then we have to let them be the pet that they want to be. We also really want to be open to watching where they thrive. Not all animals, even if they show the initial characteristics of being a therapy animal, are going to enjoy the work. It's why it's so important that you spend a lot of time with an animal, getting to know them, training with them before you start calling them a therapy animal or doing your evaluation. You need to have that established relationship where you learn their behaviors and their quirks. So we've talked about how I select adult dogs and rescues, but I also want to take a moment to talk about the selection of puppies. Now, I've done some videos on puppy selection in general, whether you're just wanting a puppy to add to your family or a puppy for therapy or facility animal work, but I'm learning so much as I work together with these two puppies, Nora, the black and white one, and Clove, who's the little golden one back here. Now, both of these puppies have been identified because they're showing great therapy animal potential, meaning they love meeting new people, they're very confident, they're very approaching. They both come from great parents, but there's also so many unique differences between two puppies who both share a lot of therapy animal potential. Nora, the black and white one, is very self-assured. She's a little bit more independent. She's very inclined to learn and perform obedience cues, whereas Clove here is just a big cuddle bug. She's lower energy and she really wants to be in your lap all the time. When you hold her, you can feel all tension leave her body and she will stay in your lap for a very long time. So when I think about their futures as therapy animals, I imagine Clove doing great in settings such as maybe a hospital where she goes from bed to bed and is going to stay very relaxed with clients and patients, or a senior living facility. I think Nora is going to want to be the star of the show. I imagine she might like working with younger populations, showing tricks, having kind of more activity in her therapy animal visits, going through crowded places. She's got some of that dynamic character to her, but is going to be less prone probably to staying still and being really cuddly. So you look for those individual differences and think about your role, what you're going to be doing, your hopes for being a therapy animal handler as you make the selection, even with your puppy. Let's take a moment to look at some classic temperament tests with therapy dog potential in mind. These aren't items that are necessarily a part of the therapy dog world, but they're strange and stimulating, making them great for assessing aptitude. I'm going to start by showing you puppy videos of the babies when they were very young, only around 6 weeks, when we were just starting to see some temperament differences. You can see Clove here in this video, who had an interest in the drill and was a bit hesitant, but she automatically looked to me for reassurance before approaching the drill. Next, you see more of the umbrella test with the pups 5 weeks later and with my other therapy dogs. Notice how they show varying levels of startle, which is totally okay. Nora is my little dramatic puppy who tends to have big reactions and quick recovery. Clove is pretty unconcerned and actually startles more because the other dogs do. Everyone recovers quickly and investigates the umbrella with loose tails wagging. We can compare this to an umbrella test with some of my rescues who are definitely not therapy dogs. They had a very hard life before me, and Stacy, the white poodle, was shut down to the point of being almost unadoptable. They love their life here with us, but you can see based on their avoidance, tension in their body, and lack of recovery, a major difference from the therapy dogs. I didn't force them to be in close proximity to the umbrella. They're behind the desk from the start. They aren't inclined to investigate, and even when I offer reassurance, they continue to show stress and hesitance.
You ready?
Yeah.
Similarly, therapy dogs might encounter interesting auditory stimuli. See the resilient bunch's response to an alarm sound. They're noticing and looking to my eyes for reassurance, but aren't showing much stress. Some barely even stop their playing.
And go.
Compare this to my shy bunch. Of the three, Isla, the little apricot one, is the most confident. Stacy, her sister, starts showing stress behavior of spinning, common for dogs who spend much of their life caged prior to rescue. They are all hesitant and avoidant, even after the sound stops. Finally, it's helpful to look at avoidant and approaching behaviors as a whole in everyday interactions. Of course, these are my dogs in my home, so this isn't a true test, but we want to watch what happens when we make ourselves available to dogs we're considering for therapy dog roles. Do they approach, avoid, or stay neutral? Ideally, therapy dogs show more natural approaching behaviors to all humans. Be sure it is a natural expression, though, and not encouraged by the use of treats or rewards. We've spent a lot of time so far talking about the characteristics of the animal, but that's only part of the equation. When you are handling a therapy or facility animal, who you are and what you hope to do plays a big role. I talked a little bit about the idea of chemistry with an animal. I think this is a very underexplored and very important area in this line of work. Along the years, I've worked with so many different kinds of animals, so many different breeds and energy levels, and I've come to learn about myself that I do best with a relatively calm, stable, intelligent, intuitive animal. That's the kind of animal that works best with me. There are wonderful, very affectionate, higher energy, task-oriented animals in this space. I find that when I try to work with them, we kind of amp each other up a little bit too much. So as you go into therapy animal selection, take a moment to think about honestly who you are. What is your lifestyle like? What is your energy like? What kind of animals do you naturally go to when you're out? And think about your role too. Are you going to volunteer in a specific setting, or do you work in a specific setting? Knowing that at the end of the day, it really is about the animal's preferences that selects the environment that they'll work in. We have to honor their welfare, have to put them in a position where they'll thrive. So make sure you consider these aspects of yourself, your job, as you go into animal selection.